How do you remember feeling the first time you walked into the OR?
Oh my God, it's super terrifying. Overwhelming is the first one that comes to mind.
Walking in the door, very scared. Holy cow, like in the corner, just white as a sheet.
I was just excited because I always wanted to, I've seen it on TV, never been in one before. So excitement.
Electric. Truly. Like all your nerves are firing.
At the time, I think I was just in awe.
Here at the very old Duke, I was a surgical tech, and I was scared to death.
My own personal experience as a medical student, and it was one of the first times I was in the operating room, and we all know that they teach you how to scrub in there very cleanly, and also the gear you're supposed to wear. As I was coming back from a break, I believe, and entering the OR towards the afternoon, I did a very good job of scrubbing my hands and felt it was perfect. And I put the mask on, and as I walked in the OR, they were in the middle of the procedure. I was just in awe. Easily there for a good 5 minutes before the attending finally turned to me and said, I hope you learned something today, but also don't forget to wear your cap next time you come into the OR.
I was at the scrub sink while still wearing a short-sleeved white coat. Someone said, did you think about how you're going to take that coat off once your arms are clean?
I definitely have seen medical students walk into the OR wearing the shoe covers as scrub caps, and that's always a like they've sort of squeezed the shoe cover around their hair because and it's really sweet because they're trying to get it, cover their hair up, but you're like no, that one goes on your feet, this one goes on your head. Everyone's trying to figure out how to do that stuff, and that all just becomes with time.
There's a certain instrument that requires the assistant to touch the instrument with cautery, so sort of something that can burn or stop bleeding. And just out of habit for years, I guess Dr. Friedman has said, well, touch me, as the sign to the assistant to, touch the instrument with the cautery. So he says, touch me, and I see this hand coming over the shoulder of a very well-intentioned medical student going to touch Dr. Friedman while he's under the microscope. And fortunately, one of the residents and one of the nurses kind of hip-checked that person out of the way so they didn't wind up petting Dr. Friedman in the middle of the surgery.
The one story that I shared with you is with regards to a student who was a Duke medical student rotating with us in a case that was a craniotomy for a tumor resection. This medical student sprang right into action. She actually joined the scrub nurse in getting things cut and made ready to help get surgery done quickly. So she was cutting up strips of Surgicel, which is a material that we use for hemostasis during some of our brain surgeries. She was loading up sutures for us so that we can close the dura, the skin quickly. And I think there were multiple things that stood out from that experience. Number one, her situational awareness, knowing that things were not going the right way and every hand was on deck. Because students sometimes can fall into the trap of just standing back and watching. But this student remarkably got right into action. And then I was also impressed by the fact that clearly nothing was too little for her. It wasn't, I am here to be part of the neurosurgery team and so I have to be at the head. But it was, I can join the scrub nurse in cutting Surgicel, in getting needles passed, in making sure that the work is going on, even if that's not what the surgeon does.
I think the key thing medical students need to understand is they can bring things to the team that the rest of the team doesn't have at that moment. However, what they do bring is things that we think are intangibles. And I clearly remember an instance where I was assisting in a very difficult case, and we were really focused on how do we technically get this person through this rather long procedure. And as we were planning for that, we were going through all the details of the imaging and the procedure and talking to the pathology. And I remember talking to the student about that, and you could see they were soaking it all in. And as we started the procedure, he started talking to me about the patient, and he'd met with him for 10 minutes by himself earlier that morning. Was able to glean things that made that patient happy, things that got him to this point in life. And ultimately, that patient did not have a great outcome. There were some complications during surgery. And after the fact, we have to start a debrief. And how do we talk to the patient now? How do we talk to the family? Goals of care discussion, all kinds of things of that manner. And the student actually added a lot of valuable input because he had sat with the patient and discussed this. And now the patient couldn't necessarily express those wishes and desires on their own, but he was able to let us know how that patient may feel. And what it allowed me to see is that we all came in this really to help patients and have a certain level of compassion. And sometimes we lose track of that in the operating room. And it's an environment where we're really focused on the technical abilities. However, the student really reminded us that that's the intangible they can bring. His communication, his compassion, love for the job is what we all need to remember on a daily basis. And that student brought that day.
So I would say that student reached out to me the night before. We confirmed a place to meet the next morning. And I was actually going to be working with that student for an entire week. So I already knew going into it that there'd be a lot of time to work with this person, get to know them, and teach them how to interact with the operating room environment. It was their first time in the operating room. And so they actually showed up on time to the operating room, which was really early because I budgeted extra time because I wanted to show them, how to set things up. So they showed up really early. They were invested and interested in even just a small task like setting up the operating room. Not every medical student is interested in doing that. And then afterwards, we saw the patient together. We got the case started. I showed her, how to intubate. Like I intubated the patient for the first time. But then the attending helped that medical student place an IV, which was good. And then for the later cases in the day, I kind of, I let her have more freedom with trying procedures. Like she already observed me do an intubation, so I walked her through the next one. And then just as the week progressed, I was like, okay, you can do the intubation. We'll be a little more efficient now. Maybe I'll do the IV for this one. And if you don't mind helping me out with charting, that would be very helpful while I start gathering, the rest of the supplies that we need and medications that we need for this case. And they offered to help chart, and it made things go a lot more smoothly for me. And then I was able to focus on, doing the timeout, things that required me to be actively participating in the surgical care of the patient, while the medical student was able to help with charting. So it worked out really well.
So I had a case that I think I will remember forever, where a young woman who was at the end of her pregnancy collapsed outside of a doctor's appointment, and she wound up having had a large aneurysm that she did not know about that ruptured. So she came into the hospital in sort of a rapidly progressing coma, and it became clear, I think, that she was needed very urgent surgery, and that the chances of her doing well were becoming slimmer and slimmer. So we all sort of reached the conclusion that that the chances of her surviving were going to be very low, and the best thing would be to deliver the baby urgently. Fortunately, they wound up getting the baby breathing, and they brought the baby to the intensive care nursery, and we finished operating on the mother and got her up to the ICU. And I was not sort of in a position to really engage much with the father. We went out and spoke to him, but it was pretty hard. And the medical student did two things that I will be forever grateful for. One, he took the time to walk the father without much prompting to see his child, so that he didn't have to wander the halls at Duke Hospital with a stranger, even more of a stranger, lost in the middle of the night, and then came back and asked how I was doing, which meant a lot. So, clipping an aneurysm in that circumstance is not something after 7 years of training I would want to do. Certainly a medical student, that's not something that they're going to get to do a lot of. But being a person in a time of just great sadness, I think anyone could try and do. Not everyone's successful, but this medical student was.
One of those things I'll never forget. So we were resecting a soft tissue sarcoma in the deltoid region from a middle-aged man. And we finished the resection in what we thought was a really good wide margin. So we were looking at just a cuff of muscle surrounding this tumor, not looking at the tumor. And in fact, we had achieved a wide margin around the tumor, and we're starting to close the wound. And the medical student says, "Hey, what's that stuff right there?" And kind of commented a couple times about this funny looking tissue that was a couple centimeters away from our plane of resection. And we all stopped and started looking at this tissue, and it was indeed something in the muscle that didn't look like muscle. So we just stopped what we were doing. We took a little biopsy of that tissue, went down to pathology, and in fact, it was more sarcoma. It was a discontinuous little nugget of tumor or a skip lesion. And we went on to do a separate resection of that. So it, probably saved this man's arm and maybe even saved his life. One thing is, it's very easy for med students to just sort of fall into the lull of the operating room and say, I'm holding the suction, or I'm trying to look attentive, but I'm not actually that interested in what's happening. And this was an example of a med student who was following along so keenly, they actually picked up something the rest of us missed, and then had the courage to bring it up until we did something about it.
So the piece of advice I got as a medical student that was really valuable, and I think I use it to this day, was if you were wearing a pair of gloves, you might do something. If you're not wearing a pair of gloves, there's no way you're going to do anything. And I was like, oh, that's kind of interesting. And so this was when I was a first-year medical student going to the OR. So every time I was in the OR, I would put on my little nitrile gloves and just stand there. And half the time I'm just standing there wearing gloves for hours. But every once in a while, there's moments that come up where you're like, hold this or do this or push on this or help me with this or put this catheter here. And you're not going to do any of that unless you're wearing gloves. So if you're already prepared, you look like you're, okay, I'm here to do. And that's really a big part of surgery is doing.
Please don't forget that you're also here to be part of the team. And what that sometimes means is there is really no part of the work that is too little for any of us, whether it's a resident or a student, or dare I say even a faculty member.
So I would just say come with an open mind, ask a lot of questions. If you don't know something, that's okay. Just say you don't know, and somebody will explain it to you. And just have a lot of humility and help when you can. Just offer to be a helping hand, and I'm sure that the people you work with will really appreciate it.
Many students who feel nervous or feel a little vasovagal, like they're going to pass out, they often think there's something wrong with me, or, oh, I guess I can't be a surgeon. But many people who are great surgeons started out in the operating room with a lot of trepidation, or passing out, or getting really sweaty and not knowing how to process it all. So however you feel is completely normal. Try your best to normalize it, and definitely don't think that it's some barrier.
Trust your ability, trust your knowledge, trust the process. As one of my friends always says, it's a marathon, not a sprint. So, just being able to know that this is a drawn out process, and you can always come back from any mishap and mistake that you're making. It'll be fun.
Most surgeons really love what they're doing and want to share that. And coming prepared goes a long way. And by prepared, I don't mean that you need to know how to do the surgery, but why is this person here? Why have they trusted us to cut them open while they are completely asleep, incapacitated, not able to defend themselves? Sort of stripped of all what most people would consider their humanity. Why is that happening? And to show respect for that goes a really long way. Also, just listen to the nurses. That would be my second piece of advice.
And the surgeons will tell them too. My first time in the OR was scary, and I didn't eat, and the same thing, I passed out. It happens to everybody, and that makes them feel better. If they get a hole in their glove, not to be ashamed to say, hey, I have a hole, I need to change. Or if they contaminate something, hold your hand up and say, hey, I think I touched that. Or if you see me contaminate something, you tell us. You shouldn't have to say, are you sure? Because if you think you did, then you just go with that.
First and foremost, everybody wants you there. Students are great because they're sponges. They soak up all the information. We know all of you are going to be great one day at what you want to do. A key factor I would always say is put the patient first. You'll hear that mantra a lot, But it's true. As long as you're trying to help out, as long as you're trying to learn, you interact with people always with the desire to make sure the patient gets the best care possible, it'll all go well. And essentially you get to learn how things really do happen with keeping the patient at the center of focus. On the converse, is also how you things go wrong when you start worrying too much about your education, more than that. And I think if you go in with the right mindset, that education just comes.
Just be open to the whole experience, and know your why you're coming into the OR, why you're stepping into medicine, and be open to the possibility of maybe messing up, but also redeem yourself and say, like, okay, I'm gonna do better. I know my stuff. I can make up for my mistake if I do mess up.
There's a couple things that are really cool about working with medical students. It is the excitement to learn about things that are, it's like exploring on like a journey that I've been on many times before, but I know they haven't. And so it's fun to go there together again, because it also reminds me of like how intricate or how delicate the moment is that we're dealing with. So it re-impresses upon me and invigorates me as I'm doing it. It's not all about that, but that part, I like doing that because I get to be excited about it again. And at the same time, I get to see their excitement about actually seeing the stuff that was in the textbook on that random PowerPoint slide, like the 16 papers that they studied or a step exam that they had to do actually in practice. And that's a fun moment to see that come out.
I think it is seeing people inspired. For me, that is like the top of it all, when a student can walk away and say, wow, I have something to carry with me to the next phase of my career.
Like a reunion. Like, oh my God, look, you're all grown up now. Now you're a resident. It's good to see that what they've grown, and they will say, I remember the first time I was here, and like, oh, you know, when you're my age, it's like your children have grown up.